Thank you very much, Prime Minister, for taking our questions. I'm Michelle Molesky from CTV Windsor. This is on the healthcare deals with the provinces. Yesterday, when you were in Saskatoon, you said that there was positive news coming in the very near future. Today, this morning, your health minister said that there was still a fair amount of work to be done. So which is it? Where are we at in terms of that deal?
We've been doing a lot of hard work over the past months in recognizing, first and foremost, that Canadians need better health care. They need access to family doctors. They need better access quicker to mental health supports. We need to get rid of the surgery backlog. We need to make sure that our elders are being properly cared for. We need to make sure that our healthcare system is able to respond not just to the challenges that we just lived through over the past couple of years, but the challenges that are coming as well. And that's why we've been working with the provinces to make sure that as the federal government invests more money in healthcare, because we know that's going to be necessary, it's going to deliver real results for Canadians. I'm glad that the health minister is pointing out that there's still a lot of work to do, because there is. But I'm also very pleased to be able to say that I am confident that we're going to get to a good place, because premiers have been hearing the same things that I have. Canadians need better health care they can rely on. The federal government is there to be supportive and to make sure that that actually happens. And I'm looking forward to continuing our work and delivering for Canadians soon.
There's a report this morning that the provinces are very close to a deal with Ottawa, a 10-year deal on health care. I'm wondering, from your perspective, how close that deal is and whether or not the announcement about more private clinic delivery has changed those discussions with the...
Well, to answer your last question first, no, that wouldn't change anything. But I always consult with 12 other premiers on this, and it's not going to be a one-off for Ontario, another for someone else. We've all agreed, all the premiers, we all have to work together and stay united, and that's exactly what we're going to do.
Hi, Minister. I'd just like to get that in English. How close do you think you are to a deal with the provinces? And also, if you get a deal overall with the provinces, do you see yourself pursuing bilateral deals with individual provinces and territories on specific points?
First, I would like to recognize that there has been significant progress over the last few weeks. I'm positive and optimistic, as the Prime Minister is also, as he has signaled earlier this week. And that's because we have seen a shift towards a focus on what matters to Canadians, which are results. Results for patients and healthcare workers. That's what people want, and that's what I believe premiers also want now. And that's great news for everyone across our country. And great news, I believe, I would also add for the health ministers, my colleagues who've worked so hard in the last year with me and many others, experts and partners across our country to signal how much more we need to do together to achieve the right results for people in the short, but equally importantly in the longer term. Because I might add in passing that what we're seeing now is obviously to a large extent caused by the impact, the severe impact of COVID-19 in the last years. But the pressure on healthcare workers has been there for many years, and that pressure will increase over the years to come. So we need to secure investments in the healthcare system so that we can maintain the publicly funded and equitably accessible healthcare system that so many people want to maintain in this country.
Next question, Louis Blouin, Radio-Canada. Minister, I'd like to hear you talk about the negotiations with the provinces again. Why do you think it's important to push for a 10-year agreement? Why is that an advantage? Answer. Look, nobody wants to negotiate in public. I think people want these agreements to be reached as quickly as possible. What's clear, and the Prime Minister has said this very well, the challenge is that the challenges in our healthcare system are long-term challenges. We have an aging population. The workforce is aging as well. And worldwide, there is a tremendous healthcare worker shortage. In the coming years, there will be we'll be missing thousands of nurses around the world. It should be said that chronic illnesses are more frequent as well. The cases on which nurses and doctors work are much more complex. People have multiple healthcare issues, for example, mental health and physical health issues. Climate change and air quality have put increasing pressure on the healthcare system. And these are long-term issues. We'll need to be there in the long term. This is what the provinces know as well. So there will be long-term investments. Obviously, there are short-term questions, but some of the challenges facing our healthcare system are very long-term question. Has it been through federal to province negotiations that you've been able to move forward? Answer. We're looking at what our patients and workers face as a whole. All the provinces are facing common issues. The health ministers I've met in recent months have mentioned the same problems: a lack of access to family doctors. Some 6 to 7 million Canadians don't have a family doctor. How can they retain workers as well? How can they recruit workers? And there's also the issue of recognition of foreign credentials. There is a series of conditions that includes mental health care issues. And there's also the question of reducing backlogs in surgery that have piled up because of COVID. And as everyone has noted, our healthcare system needs to be updated. We need to offer access to data that allow lives to be saved. There also needs to be increased capacity for healthcare workers to collaborate. We have to stop using faxes, for example. We have to allow, or enable rather, healthcare workers to work as teams so that work can be done in time and safely. These are all issues that concern people's health. They also concern healthcare workers and their conditions. They often don't have access to information on their patients quickly enough to be able to treat them properly. So we're lagging behind other countries on these issues, and that's why the Prime Minister has stated many times the importance of improving the quality and the use of data. We absolutely need this to be able to do a good work, for our healthcare workers to be able to do good work.
Minister Duclos, both Premiers Ford and Legault have now indicated they're willing to participate in some kind of data sharing arrangement with the federal government on metrics for their performance of their healthcare systems. That we were led to believe was a key stumbling block to the negotiation so far. What are the remaining impediments, and are there other provinces that haven't agreed to that is causing delays in getting this deal done?
I believe most people now recognize the importance of data to save lives. In COVID-19, we could have saved more lives if healthcare workers had better access to data and information on people's health and on the system in general. And therefore, that conversation is around how to protect the lives of people and how to improve the quality of care given to people. That's what the Prime Minister is signaling when he says that he wants a better and a more modern health data system, in part to support the effort that the Government of Canada must keep improving and enhancing in supporting provinces and territories in all of these long-term challenges that we know are impacting our healthcare system and our healthcare workers. So I wouldn't be surprised if our premiers admitted that openly in the near future, because all of my colleagues, health ministers, know that really well. We've spent a considerable time in the last year with the leadership of some key provincial health ministers to work on that file, the modernization of our healthcare system, including a more modern health data system.
The NDP this week said that no more federal money should flow to the provinces for healthcare if there is privatization, further privatization in the system. Ontario, as you know, is going to start outsourcing more surgery, starting with cataracts and moving on to others as well. Will this be a condition of any increase to the health transfers to the provinces? Is adherence with the Canada Health Act and limitation on further privatization of delivery of services, not just payment?
We all have different roles in this country around healthcare. We have the common responsibility of upholding the obligations of the Canada Health Act. The good news is that everyone recognizes that responsibility of upholding those obligations, and everyone admits that openly. So you've heard that in the recent days. Now, we need to maintain public funding. We need to make sure that our healthcare system is equitably accessible to everyone, regardless of where that person may live and regardless of that person's income or financial ability to pay for services. Now, there are ways for the federal government to make sure that this is done. Now, there are penalties that can be imposed, that have been imposed, that will be imposed probably in the future when those obligations are not upheld by provinces and territories. But in my understanding, based on the recent conversations, is that those obligations are well understood and will be upheld by whatever changes to the system that my colleagues in provinces and territories will want to make.
Prochaine question, Michel Sabat de la...
Next question, La Presse Canadienne. Hello, Minister Duclos. Premiers Legault and Ford are ready to share healthcare data, as the federal government has been requesting. Would it not be the least of things to state how much money you're offering and tell us if you're willing to increase the Canada health transfers up to 35% of expenses, as the provinces are requesting? Answer. That's an excellent question. And you're talking about the means to arrive to an end. That's what we're working on right now. The good news is that the results we're focusing on, that is, I and the premiers, we've been working on for more than a year. So we're able to advise our bosses, the premiers and the Prime Minister, what is coming and what will be done to help the provinces and territories to be able to do their job. The Prime Minister, or rather, we are focusing on results for patients and workers. Question, will there be a privatization clause in the agreement? The good news, answer, the good news is that everyone recognizes that there is a role to be played and that there is a responsibility that comes with this, that is upholding the Canada Health Act. We need to have a publicly funded healthcare system. People shouldn't be showing up with a credit card to get healthcare services. And the changes that the provinces and territories put in place must comply with the principle of equitable access. There are legitimate, quite natural concerns with regard to the provision of healthcare services by the private sector. The details are important, and we're keeping a close eye on what's going on. Everyone agrees that there is a shared responsibility to comply with the Canada Health Act and meet their obligations.
Thank you. And before Christmas, there seemed to be a bit of an impasse between your government and the provinces. We all remember the meeting there where we didn't get any kind of real outcome. What was the tipping point that has now allowed progress to be made? Was it that Ontario and Quebec moved on data? Was it something else? What has allowed these negotiations to sort of start up from where they were before Christmas?
I think the good news comes from the fact that we are increasingly aligned on the challenges that the health workers are going through, the stress and the lack of care that people sometimes feel and fear in our country, and the fact that those challenges that we're seeing in our healthcare system are long-term challenges. Yes, resources and additional dollars will be provided by the federal government, but they need to be invested in ways that will make a difference in the lives of patients and workers across Canada. So the results conversation is stronger now than it used to be just a few weeks and certainly a few months ago. That's great news, and I'm quite optimistic it's going to continue to move in the right direction.
I wanted to ask, when you talk about data collection, would that be within the provinces themselves collecting data, or would that be a national system of data collection?
Well, the most important data collection that needs to take place is in the healthcare system itself. It's data that nurses, physicians, lab technicians, pharmacists can use to increase the safety and the quality of care to people. No, lives can be saved with better data. So in Canada, we don't have yet a modern health data system. We have a system that is unfortunately less good than what we see in other countries. And that's obviously a serious source of concern, because if we did have had access to better data in COVID-19 in situations, for instance, we could have saved more people's lives. So we want to step up our game in having a good health data system in Canada for the purposes of better health care to people, and also the purposes of helping workers do the job that is so difficult for them in the absence of appropriate data information on their patients. So that's the most important thing we need to do. As we do that, as we improve the quality and availability of data in hospitals, in physician offices, in pharmacies across Canada. As we do that, then we necessarily give provinces and territories a better idea of how to improve the management of healthcare and where they need to invest their resources. No, is it in this particular sector, in that particular technology, for that particular type of drugs? It also gives them better information on how to improve the efficiency and the equity of care to people. And then we can use that nationally, because there is a gain to having national data available to people across Canada. We have the benefit of having a federation of 10 different provinces and 3 territories. So when we put those data together, then national experts, doctors, nurses, specialists, they can use those data and advise everyone in Canada on how to provide better access to the most appropriate drugs at the most appropriate time, in the most appropriate way. So it's a great source of progress that we can make when it comes to the, as I said, the quality and the availability of data.